you get this huge queue of all of these images, and if the only thing you can see in your workflow is just kind of the patient's name or whatever, you have no idea which ones you should look at first versus not. And so by having this AI system that runs behind the scenes and goes through all these images, identifying things that might be emergencies, it can fix that order and prioritize them and say, hey, let's, we'll flag these three. These have some alarming thing in them. Human, you need to go look at this now to just check if there's really an emergency here.
So should a radiologist be worried that they're not going to have a job in the future?
What are you most excited about in the AI space these days? If you pick the wrong problem to solve and you're just trying to force AI onto it, that can definitely end poorly.
Yes.
Because you need to understand like who's going to benefit from this and why are they going to benefit, and also why specifically is AI the right tool to solve this particular problem.
AI, is it hype or help? G'day and welcome to the show. I'm your host, Pete Cooper, and our topic is AI, hype or help. Today's guest is Rachel Draus. Rachel and her company Glassbox Medicine has an incredible backstory. She has been involved in medical imaging, various aspects of AI across the healthcare. She's also a double doctor. That means a doctor of medicine and a PhD doctor. We go really deep into medical imaging and a whole bunch of other things. This is a fascinating deep dive into AI in healthcare. Let's get into it. Welcome, Rachel. Welcome to the show. How are you today?
I'm doing well. How are you?
I'm good. I'm good. Thanks. I've been looking forward to this. We met recently and we had a lot of intersections in the type of work that we do. And I wanted to spend this time with you going in deep about some of the layers of our work and how it pans out in the AI world. AI is a big space now, and there's lots of specialties appearing. No one's an expert in AI, but there's many people who are experts in parts of AI, and I think, Rachel, you're one of those. So why don't you introduce yourself and what your business is? It's Rachel Draus from Glassbox Medicine, correct?
Yes, thank you. And happy to be here today. I'm a physician with a PhD in AI. I'm the founder and principal consultant at Glassbox Medicine, where I do AI strategy and implementation projects across all industries. My specialty is custom models on proprietary data sets, especially in computer vision, natural language processing, and domain-specific data sets. In healthcare, I've worked on projects spanning 2D medical images, 3D medical images, medical video, medical audio, EHR data, and omics. So lots of healthcare experience, and excited to talk today about AI and healthcare AI.
Rachel, that was fantastic. You kind of fire hosed me there with lots of stuff. I'm going to start from what I remember at the beginning and work through. So you said you were a physician. Now, a physician is a doctor, right? So you actually were a practicing doctor. Let's start there.
I did go to medical school. I was at Duke. I did my MD and my PhD there. And after my clinical training there finished, after I got my MD, the normal thing for me to do would have been to go into residency, but I actually went into the health AI space after medical school. So I am a physician, but currently focused on health AI and not actively seeing patients anymore.
So if people don't know what the word doctor means, it has two meanings. It has a medical doctor who is a physician, as you described, but it's also somebody who's got a PhD. They can also be a doctor, but you actually are both. Is that correct?
Yes, I am both.
It's very, very rare. I don't know anybody else who has both a medical doctorate and a PhD doctorate. Do you know
It
anybody
was
else like you?
so actually my husband.
Oh, well, there you go. Well,
Well,
he's got to come on the
we met
show.
in the training program. But yeah, it is an unusual degree combination. In my medical school class, there were, I believe, 120 students, and 8 of us were doing the combined MD PhD program. And around year 4, most of our medical school classmates graduated, and then the rest of us, we were still around. So in total, it was an 8-year combined program. And around year
Wow.
6, I remember thinking, this is actually pretty long.
Yes.
So
Wow.
it was exciting to wrap that up.
Wow, what an undertaking. And it kind of makes more sense now you frame it that it was actually a structured program that brought the two things together. And you've continued down the sort of the PhD path in your research area. So there are other people out there in the world that are as rare as you. That's a comfort to know.
Yes, I'm not the only one.
Yeah, yeah. So why did you choose to go the PhD route versus the practicing doctor route?
That's a good question. It was a really tough decision because there were certain aspects of patient care that I knew would not be replicable outside of direct patient care. And there is something really meaningful about, directly delivering care to sick people. I really liked internal medicine in an inpatient setting. I also really liked emergency medicine. I think if I had gone on to do more clinical training, it would have been in either one of those areas. I ended up deciding to focus on tech because basically I had to come to grips with the fact that no one can do everything. I think up until that point in my life, I had sort of kidded myself that, oh, if I just work hard enough, I can do everything. And I reached a point where I realized actually I can't. I can't do everything. And I had a lot of things I cared a lot about, and I was really excited about AI. I did think clinical practice would be really meaningful. At the time, I was running a startup, a health AI startup that I was excited about. I have my family. I also really like to write, and I had this huge list of all this stuff I really like. And I thought, okay, well, I'm gonna have to maybe whittle one of these things off the list,
Yeah,
and that
yeah.
ended up being clinical practice. So yeah, that was how that came to be, and I ended up steering into the AI space.
Yeah, and you're happy with that decision?
I am. Yeah, I
Mm.
am happy with it. I think it's a good match for my personality. I mean, there were aspects of, like I said, there were aspects of clinical care I really liked. There were also other aspects I had a hard time with. So, I mean, some people are really good at compartmentalizing. Some terrible thing will happen to a patient and they're able to kind of leave that at work and box it off. And I was not one of those people. So I think it suits me to be, a little bit further removed from kind of daily tragedy, if you will. I'm still very passionate about helping patients, but I think for me, it works better to do that from the tech angle.
Yeah, interesting. So I'll drop this in now. My daughter, she graduated from medical school a couple of years ago. She's now a practicing doctor in Australia. But she kind of did things the other way around to you. She went and did a different degree in I'm probably going to get this wrong, so I'm not going to say what it was. It was another degree, and then she came in and sort of got her head square about where she wanted to be, and then decided to become a doctor. Sort of, so she's tried something else and then became a medical doctor. Um, and I think she's happy doing it. I mean, she certainly tells me some of the challenges that she has, and she just says it's hard work, very hard work being a doctor.
Yeah, definitely hard work and rewarding. I think it's a nice profession, and my husband, he is practicing, and so I still get a little window into that side of things through him.
All right. Oh, cool, cool. So we got some good background. So Glassbox Medicine, tell us a little bit about that aspect of your business. What's that about?
So Glassbox Medicine originally started out as a blog. It still is a blog. It's glassboxmedicine.com. I write about AI and healthcare there. And over time, I was adding more and more articles, getting more and more readers, currently up to 700,000 lifetime readers across 185 countries. So there's only a few countries missing, and the countries that are missing are like countries without internet. So,
Wow.
so maybe they won't end up reading it. But anyway, I was writing this blog and I was working on my previous startup. And then after I wound down my startup, I had started dabbling in consulting. I thought I really should amp up this consulting angle and began working on more and more projects and realized it was really exciting to work with different teams across both different tech companies and medical organizations on implementing AI. Also did some AI projects outside of healthcare, and so ended up kind of merging my blog and my consulting under this Glassbox Medicine umbrella.
You dropped in that very quickly. 700,000 users on people that come to your blog and read your blog post.
Total. So yes, over the lifetime of the blog, that's the total. It might actually be close to 800,000 by now, but yeah, I think I've written about maybe 70 or 80 posts,
Mm.
and the blog's been up for probably 5 or 6 years. So yeah, that's the total, and it's interesting to see over time which posts continue to draw traffic and which ones. I wrote this post one time about explaining chest x-rays and what you can see in chest x-rays, and this is really relevant because a lot of people getting into health AI, one of the first things they'll do is they'll build a chest X-ray classifier to identify abnormalities. And that
Hmm.
post gets so much traffic. And I never would have imagined when I wrote that post, I never would have imagined that that would turn into one of the most popular posts on the blog. So
So
guess
yeah, interesting. I mean, how many years did you say you've been running it? Yeah,
probably about 5 or 6,
5 or
maybe
6
longer
years.
now because time flies.
Right. And how many articles and blogs would you have up there now?
There's around 70 somewhere in that ballpark.
Okay.
And it's a wide range. Some of them are pure AI. So I have some up there, especially from when I was in the depths of my PhD, where I was dissecting some AI research paper. That's what some of them are. Some of them are squarely in the healthcare side. So I have a series of articles on explaining different body systems and medical terminology, which can be really helpful, especially if you're working on uh, something with text where there's a bunch of medical terms. It's useful to know what they are. And then I have a lot of articles that are at the intersection where it's about something that is both AI related and healthcare related. For example, automatically
Mm,
interpreting medical images with
mm.
AI.
Yeah, so it is all around AI and healthcare. And we're
Mhm.
going to put a link in the description of this podcast video so people can go and have a look at that because it sounds like this is a really interesting topic, isn't it? Because the US government, or the US market for healthcare has recognized there's an enormous amount of administrative costs. There's a huge burden. Um, I believe maybe you two do too, that there's an opportunity for AI to really help take some of that waste away because waste means that money goes into the system and it doesn't come out in terms of healthcare. It doesn't come out to, the providers. It ends up being wasted in the system. And I believe
Mhm.
it's a third of $1 trillion. It's about $265 billion is wasted in administration. And you're talking about something specific around X-rays and imaging. But also there's this other side of AI which we can get into. But let's come back to your X-ray AI. So to me, this sounds like you get an X-ray and you put it into the computer and the AI model runs and says, oh, there's a problem here, possible cancer or some other artifact. Is that what you can do? Is that where your research has been?
So yes, I have done a lot of research and a lot of consulting projects in the medical imaging interpretation space. And yes, that's basically how it works. So you would take a medical image, it could be an X-ray, which is 2D grayscale, it could be an ultrasound, which is 3D grayscale, or a CT or an MRI, really any kind of medical image, and you put it into the model. And there's a bunch of different things you can do with it. One of the most popular things is just figure out what's wrong with it. So that would be a classification task where you might say, oh, there's cancer, or there's a lung nodule, or the heart's enlarged, something like that. But you can also do other kinds of tasks, like you can put boxes around different findings. So not only are you saying, oh, there's a lung nodule, but you put a box around it. And then you can do segmentation tasks where you're actually identifying every single pixel that's part of some particular abnormality. So you might say, oh, there's a lung nodule, and here's all the little pixels that are part of that lung nodule. And it's one of the most successful areas in clinical health AI. I believe out of the FDA-approved medical devices, roughly 70 or 80% of those are medical image interpretation systems. And there are lots of ways it can directly have a positive impact on patients. Like there's companies that do kind of early detection of emergencies in medical images, so they can flag, hey, this person's medical image shows that they're having a stroke, go treat them. And by shortening the time to treatment, that can really improve patient outcomes. So it's a super exciting area. And I will also just throw out there, because this is one of my pet peeves, you cannot just chuck your medical images into ChatGPT. It cannot interpret medical images.
Yeah,
And
damn it.
I often come across people who think that it can, and they're like, "Oh, we want to, deploy ChatGPT to interpret these medical images." I'm like, "No, stop! You're gonna hurt people." So all these medical image systems are, they're typically purpose built for a specific task. Like this is going to be our medical imaging system for interpreting, this particular kind of X-ray or
Yep,
something.
yep, 100%. So that's how me and my company got into AI was through vision systems. And classification is something we did a lot of, and I call that deterministic. I think you do too, where you're determining a particular class. We were determining people and traffic, cars and bikes and things, and we call that a class. A car is a class, a bike is a class, and so it's determining with a certain level of confidence what that class is. Now, we talked about that in the medical imaging space, diagnosing a cancer. It's a class, right? So that's a cancer class, and it could be other classes. stroke classes and things like that. But then you talked about something else which I didn't quite get. It was you called it segmentation, I think. What was that exactly? Can you just go over that again?
Yeah, so segmentation is where you get an image and you want to identify exactly where something is. This can be especially useful if you care about how big it is. And the way you do that in terms of building it in AI is you actually have essentially a classification task, but on every single pixel of the entire image. So if you feed it an X-ray, you're doing basically classification on each pixel, and you want to know which class is each pixel part of. And then you can make these pretty visualizations where you have your original image, and then overlaid on top of it, you kind of have traced exactly the borders of something and filled it in. So you know, oh, this is
Oh,
all
right.
part of the, this is all part of the lung nodule, or maybe you're doing it for whole organs or something. So you know, like, oh, this is all the liver. And what's cool about that is that if you have processed your data so that a single pixel corresponds to a certain distance in the physical world, then you can track the size of something over time. So maybe if you're looking at lung nodules, you can track, did this lung nodule get bigger?
Oh, gotcha. So yeah, it's not obvious to, I think, people who are outside the space that when you look at an X-ray, it's not like looking at it's not like having um the liver in your hands where it's obvious that's the border of the liver. It's a little bit more nuanced than that, right? It's not always 100% clear what's the liver and what's the not liver. And so this is where AI can really come in and really help the physicians. Oh, this is part of the liver, and the cancer is either in the liver or out of the liver. And that informs them about the diagnosis, informs them about possible surgery and all those other things.
So, I mean, yes, there's definitely within medicine, the radiologists they're the experts on all the medical images. So, they'll tell you, this is exactly where all the different parts are, and this is what this rare finding is. But then if you're not a radiologist, it can be difficult sometimes to understand exactly what you're looking at. And that is one of the possible deployment areas of these kinds of systems, is helping physicians who don't have that deep expertise in specifically medical imaging understand exactly what they're looking at.
So should a radiologist be worried that they're not going to have a job in the future?
People have been talking about that for a long time. When I first started my PhD, I definitely bought into that angle. I thought, in a few years, we're going to have completely automated radiology. I no longer believe that we are imminently
Hmm.
completely replacing radiology because of a couple things. One is that there's just so many thousands of possible conditions, and the distribution, it just has a very, very long tail. So there's all of these super rare types of abnormalities, and you might not see very many examples of them. And that's the kind of thing where a person tends to be a lot better at identifying those than an AI system. And so that's
Oh,
one thing where humans are still doing, I think, better than AI in a lot of cases. And part of that could be a data limitation, but it is also partly due to the fact that a lot of these models do preferentially tend to do best on the most common categories. And then another reason is that there's a lot of quirks in medical imaging that make it difficult to automate that might not be immediately obvious. So one example is that all of the different scanners can produce images that have differences which to a human are not obvious, but that a machine can pick up on. So for example, there might be some kind of processing artifact that's kind of distributed across the pixels that identifies like, oh, this image came from this scanner. And that, on the surface seems like, well, why is that even relevant to interpreting medical images? It's relevant because if you have a training data set that comes from a couple different places, and the disease distribution is different at these different places, and then the model can also see where they came from, it could look like the model's getting good performance, but it's not actually looking at the abnormalities. It's just looking at where it came from. So there was a study back, I think it was back all the way in 2018, where there was a model that could predict pneumonia from X-rays, and the performance looked really good. If you looked at the numbers, they were impressive numbers. But when they delved deeper and did some explanation methods on it to see which parts of the image the model was looking at, it was looking at all this weird stuff. It was looking outside the patient's body and like the air around the patient's
right.
body. It was looking at the metal tokens that get put on the patient to say which side is the right, which side is the left. And it turned out that there was one hospital that had a much higher prevalence of pneumonia and a certain X-ray machine, and then another hospital had a much lower prevalence of pneumonia and a different X-ray machine. And so the model had just learned how to distinguish what machine took the X-ray, and that was all.
Oh,
It wasn't even looking at the
understood.
patient's lungs. So that's something where subtle things like that can make it a lot harder to automate than it might seem on the surface.
Yeah, that's really interesting. So when you get down into the nuances, it's not as straightforward as throwing the image in and getting a result out. Um, and it's something so critical too. I mean, there's real consequences, and AI doesn't necessarily care about the consequences. I mean, you know as well as I do that, especially LLMs, are there to please you, right? In the moment, please you in the moment. It doesn't really care about its reputation as a doctor or as a radiologist, which is something very human,
Mhm.
and hard to replace. I mean, we have accountability as humans, and so the long term matters to us. We associate ourselves with a network of people and we want to be a good radiologist. But I still think that you touched on a few other things. So perhaps the combination of AI and radiologists gives some better outcomes when they're matched together well.
There definitely are use cases like that. So the one I mentioned before with kind of early detection of emergencies, I think that's one of a great example of something where humans and radiologists are both together. And what the AI adds there is that the AI can run very quickly, basically immediately on images as they're flowing in. And so what it can do is you get this huge queue of all of these images, and if the only thing you can see in your workflow is just kind of the patient's name or whatever, you have no idea which ones you should look at first versus not. And so by having this AI system that runs behind the scenes and goes through all these images identifying things that might be emergencies, it can fix that order and prioritize them and say, hey, let's we'll flag these three, these have some alarming thing in them, human, you need to go look at this now to just check if there's really an emergency here. So
Right.
that's I think a great example where you have an AI, you have a person, they're both working together as part of the same workflow, and together they do better than either one by itself.
So just let's make manufacture a scenario to make it clear. Somebody comes in from a car accident. They're unconscious. They're pretty bad shape. They can do their basic checks, the doctor will look for some things and then they'll go to get some x-rays, right? And there might be multiple x-rays. In a traditional setting without AI, they would call the radiologist down, and there's this time lag as you get the x-ray, it gets printed, he does the work. All the while, this guy's unconscious on the table and they're waiting to know what to do. So they're just in a holding pattern. And we can shorten that time. Is that right? Shorten that time that the person's in this no man's land of not knowing what to do.
Yeah, it can shorten time to diagnosing so that it's clear earlier what to do, and it can also catch problems that you may not even have expected. So maybe someone came in because they were having a really severe headache or something, but then they get some imaging and you discover like, oh, actually there's this other process going on at the same time. So there's an additional opportunity too where sometimes it'll sort of catch surprises.
Yeah. Well, this is great. Thanks. We've got a good clear picture of that. So medical imaging isn't just x-rays, though. It's MRIs, CAT scans, those sorts of things. Is that also, can it also be done with AI?
Yeah, definitely. And I've worked on projects on X-rays, MRIs, CAT scans, the kind of whole gamut, and all of those. The main difference is that CTs and MRIs are just bigger, which maybe years ago would have been a problem, but now GPUs are so massive that it's really not a problem anymore. There's just these enormous GPUs that are completely fine training on these gigantic images.
All right. So all of us are familiar with using the chat. And this is done with the browser, and we talk to a model which is in the cloud, and everybody has access to it. With these types of models, are they usually running in the hospital? Is there a cloud interface to that special model? Are they running on a local computer? Where are the models actually housed?
That's a good question. I mean, for most startups in medical imaging, I believe those are typically cloud-based. So they're
Mm,
running their own kind of server in the cloud, and that's where the image goes, and that's where the model is, and it gets interpreted, and then it kind of sends the result out.
mm,
But there's no inherent reason why you couldn't have one that was locally deployed in a health system. And I'm sure that there are some health systems where maybe they have an in-house model that they developed with their own team, and then they could run that locally. So yeah, in terms of infrastructure, you basically once the model's already trained, you basically just need a GPU that can run it, or maybe a few
mm,
GPUs depending on how
mm.
big your model is, and then you can go.
Has this mainly been startups doing this type of work, or are we seeing some of the big corporations as well coming into this and offering sort of that type of service?
It's so within healthcare AI, I think the majority of the spending does go to startups. I think somewhere around 70 to 80% goes to startups, but there are certainly huge companies that work in the health AI space. So, for example, Microsoft has a lot of different health AI kind of projects that it does, and Google has a
Oh,
bunch of health AI projects that it does. I think actually to some extent, all the big companies. I mean, Amazon has its One Medical, and I'm sure they've got I'm sure
right.
they've got some AI associated with that. So yeah, it's interesting because the big companies also have so much else that they're doing. So if you're looking for a company that's purely focused on health AI, that's more likely to be a startup, because the startup's more likely to have a narrower mission.
Right. I was gonna go down that path of, well, do you have people that analyze X-rays for livers? Like, is a startup that narrow, or how does a startup find its own niche? What defines its niche? Well, can you give me an example?
Yeah, so I had a colleague actually who started a medical imaging company, and their initial niche was looking at catching lung blood clots in CTs. So the CT scan might have been acquired for some other reason, or it might have been acquired because of concern for blood clot. It didn't matter, regardless of why the CT was acquired. If it had the patient's chest in it, it went into their pipeline, and then they detected if there was a clot in the blood vessels in the lung. And that's really useful because these clots can be extremely dangerous. And so if there is one,
Mm.
you want to know that it's there, and
Oh
you
yeah.
especially don't want to miss it. And the funny thing that happens when people interpret images is, if, especially for these kind of incidental findings, if you get an image for some other reason, then when the radiologist is looking at it, they're not primed to be looking for a blood clot.
Yes.
And part of their workflow is to check for other things that they're not expecting. That is like a normal part of radiology practice. But it's extra helpful in those situations to have an AI system that can catch this. And so the way their product worked is, if they didn't see a blood clot, there would be a phone call that would automatically go to the radiology team and say, hey, there's this image, it has a blood clot that might have been missed. Go back and check the image. And that was their initial product. So yeah, it's definitely possible that companies will start out with an extremely specific problem that they're solving. And that's, for a startup, probably better. If
Yeah.
you're starting with something that's highly specific, that's better than trying to kind of solve all of radiology at once.
So are there hundreds, are there thousands of medical imaging model providers out there now?
That's a good question. I don't actually know. I don't actually know the total number of medical imaging startups. I
Well, I guess the number's not important, but it's just I'm thinking to myself, if I'm a hospital or a doctor or whatever, I'm going to have to subscribe to all these different companies for all these different things. Like it's blood clots in CT scans, it's liver damage from drinking. It's like whatever it happens. Do I have to have hundreds of subscriptions and then push it out to all of them? And or how do I know which one to use and how do I subscribe to them all?
Well, I mean, I think the interesting thing is that they're all solving somewhat different types of problems, and the existing, radiologists still very much have jobs and work within these health systems. And so the baseline is that, these images are getting interpreted, and the radiologists are going through the images and interpreting them and doing that critical piece of the workflow. And so it's not so much a question of like the images aren't going to get interpreted if we don't have these AI systems to do it. It's more that, in this particular setting, like maybe in this particular health system, could we benefit from adding a system that will solve a particular problem? And going back to kind of the lung blood clot example, you might be interested in that if you were a health system where you have a CT scanner and you do a lot of CTs. You're probably not going to be interested in that if you're like some random outpatient practice, and maybe you send patients out somewhere else to get CTs, but you don't actually do them yourself. So
Right.
there's different kind of there's different niches and different reasons that an organization might want or not want to purchase access to a certain model.
So in the past, we would have had the radiologist receiving the films, and he would be the resident radiologist for the clinic or for the hospital, and he would be doing, there might be multiple, but let's talk about one, and he would do it basically himself. Now he's the guy that takes them and says, okay, let's try this model and this service and that service, and push them out and then get those results, as well as his own interpretation.
So actually, I don't think in a lot of cases the AI is kind of between the radiologist and the image in that manner. It's more like the AI is a parallel system running behind the scenes at the same time as the
Okay.
radiologist. So
Okay.
the AI system just is plugged in computationally, and it gets the flow of data as it's as these images are being collected, and then it runs on whatever parts of the data are relevant, and then it will do different things with its predictions depending on what the purpose of the system is. So the radiologist will still do their normal interpretation of the images, and they don't typically choose which model it goes to. It's more that like if a health system has partnered with a certain company, then those companies' models will kind of parallelize with the radiologist, and then maybe there'll be a kind of alerts that go out to the radiologist depending on what the models find.
Okay, so this other company, which is bringing all these models, they're like an aggregator for all the models coming in from all the startups, and so they become the machines send those images to the aggregator. The aggregator says, okay, these are the models we're choosing from, and then gives the results back.
The hospital system itself will typically have like a PAC system, and they'll have their images that go basically some computer somewhere.
Yeah.
Some computer somewhere, which like in the old days only the people would be reading off of the computer, but then with if you have an integration with some company that does medical image interpretation, those images could also go to that company as well.
Oh, all right. Well, we went deep on the process because I'm trying to think if there's people can relate to it by what they experience when they have services, and it sounds like it's all happening in the background. And the main benefits are they might get a better assurances, faster, and maybe in some cases even cheaper services. So if I was a startup, how would I go about doing such a thing? Do I need to get thousands and thousands of images and throw them into some model training and then have, I guess, radiologists and other people guide that um to some result? Is that how a startup would get going in this space?
Yeah, so you need the thousands and thousands of images, and getting the data and making sure it's the right data is often tricky. And I'm actually have
Yes.
some colleagues who started a company to address that problem. So
Hmm.
it's called Gradient Health, and they actually aggregate medical imaging data for the purpose of then licensing it to companies that want to develop these models, because a lot of times getting the data is really, really tough. If you're just trying to start a company and you're at square one and you don't already have anything, it's really, really hard to convince a health system to give you their data. They don't want to
Yeah.
do that because they don't know
Yeah.
who you are. They don't trust you. It's patient data. There's all these laws around it. So yeah, getting the data can be tricky, and you have to also be really careful about how you construct your data set. So it does need to be large enough. That's one of the biggest barriers. Is I work on a lot of medical imaging projects, and sometimes people will come to me and they'll say, oh, I have 2,000 images, and I really want to get this to be almost perfect performance. And I'm like, well, it's probably not going to be almost perfect performance with only 2,000 images, because you got to, the higher performance that you need, the more training data you need for the model to be able to perform well. And then also the data needs to be reflective of where you intend to deploy this. So something that can happen that can sort of derail things is, let's say you create a data set and you create it entirely based on this one hospital system, and you used, all this data that they had, and you train your model, and then you want to go deploy it in some other hospital system. You're going to have to be really careful when you do that, and do a lot of work to check how it performs there, because there's a lot of reasons why it might catastrophically fail. So for example,
Mm.
if it has learned any of these correlations between like different scanners in different departments correlating with different diseases, anything like that, and you try to put it somewhere else, there's just a lot of ways it can go wrong, and you want
Yeah.
to make sure that the data is appropriate. And if the data distribution changes over time, maybe you have to retrain your model over time as well.
Yeah. Yeah. Well, that was fascinating. We took a real bend in the river there to go and explore this world of medical imaging in AI. And I think we could keep talking all day, but let's talk on a different angle on this because you've been working in AI in other areas too, right?
Yes, I do work in other areas. So some projects that are totally unrelated to healthcare, and then also within healthcare, other sides of healthcare. So, billing, omics, EHR data, notes, lots of different other parts of
Well,
healthcare
let's talk
AI.
about billing because this is an area we've been working in as well. So tell us what you've been doing there.
So I did work on a project related to insurance claims and claims denials, and trying to do some automated processing there. And that, I mean, that's a huge area just in terms of the broader, health AI landscape. Revenue
Yep.
cycle management automation is huge.
Yeah. So back to the top level. The billing side of things seems so complicated to me coming from Australia. which seems to have a very simple system. I think they've got half a dozen insurers, and over here you've got hundreds. And you always have this complex arrangement at the moment where the physician has to justify the coding so they can get the rebate. Um, it's much simpler in Australia than it is over here. And I believe, and we're sort of stepping into this ourselves, is that AI has the benefit is it can take all of the documents that are associated with that particular code or sequence of codes that you think it's the, and then read them all and say, well, yeah, this one matches best to this one by its ability to read fast and match. Is that your understanding of one of the benefits we have coming with AI?
Yes, so it does help simplify the enormous unnecessary complexity of the US kind of insurance paperwork thing that's going on. I recently read The Healing of America, which I think was a New York Times bestseller. Super interesting look at the US healthcare system and healthcare systems around the world, diving into all these ways that there's many other countries that have solved certain things which remain a problem in the US, one of those being the very complicated nature of the insurance reimbursement. So yes, I think this is also an example of where the ideal solution to this problem is just a policy change. Like that's the real ideal solution is we just dramatically simplify the way that billing works from like a legal level. But if that doesn't happen, then AI can certainly help by going through all of the different painful steps of that process and trying to save a person from having to manually deal with them all.
Yeah, I heard one of the guys on the podcast earlier this week said that a four-person team would take an hour and a half to do this work. Now with AI, they're doing it in 1 hour and a half, right? So so four-person team, half a week down to an hour and a half. So that's like a 15 to 20 improvement in time, as well as
Mhm.
being quite a tedious process.
Yes,
Yeah.
it's definitely a great opportunity, and I think also something nice about it is my understanding is sometimes their business model is like a percentage of extra money that they're getting you or something like that. So, it may end up with more reimbursement than you otherwise would have, especially I think in some cases, if you're, independent practice, maybe you lose out on possible revenue just because you don't have the personnel to go follow up with every single denied claim and all of this. And so if the AI system is there doing that for you, you might end up making more money.
Yeah, well, it was only a few weeks ago, a dental practice, no, an eye practice, an optometrist, one of those, said that they were a fairly decent sized practice. They said there's probably $20,000 a year still left in the system. We just can't find it. We just kind of write it off. And I thought to
Mhm.
myself, well, $20,000, that's a nice holiday to Europe for the owner and his wife. I mean, that's got to have some value, hasn't it?
Yeah. Yeah, I mean, the AI system can certainly unlock that because if the alternative is that you're spending like a month doing all this paperwork, then the $20,000 becomes possibly not achievable. Maybe you have no extra staff who can do that month.
Yeah, yeah, 100%. I mean, our direct example is the Australian physical therapy clinic that's saving $2,000 a month because the AI is stepping in and doing some of the heavy lifting. Now, it's not perfect. We have quite a few that fall outside of what AI can handle for various reasons. I mean, one of the problems is that all of the different insurance companies have different ways they want you to interact with them.
Mhm.
There's no standardized way of sending the invoices through. So some of them are all batched up. Some of them you have to go in through a one-time password type portal, and that slows everything down. And we've kind of got ways to speed that whole thing up. And then what we found was the presentation of the data by collecting all those pieces and showing the bookkeepers and the accountants, oh, this is what we're seeing, the three panels. Okay, I know that that number isn't the same as that one, but I can tell by the rest of it that it matches. So that's that go ahead and reconcile it. And we're able to get sort of 66% at that. Our goal is 80%, but we're at 66. I think we started at 10. Now we're really starting to get somewhere with it.
Yeah, I mean, that sounds like a big difference for sure.
Yeah, yeah. So you're working in the same space in a much more complex area over here in the US. It's not only is it, oh gosh, 20 times more people here, maybe 15 times more people here. It's also fragmented through states much more than it is unified in Australia. So there's an Australian federal system. Of course, there's a state system too. We've got so many more insurers, then you've got the billing codes on top of that. Um, it's really a challenge, isn't it, to unravel the complexity. Now, with AI, it can actually make things worse. So I had a meeting with someone this morning, and they were trying to drive AI into their organization, and she was frustrated. She said, "Look, the founder wants to use AI and he's making me do this, but it's upsetting my workflows and I can't use it sometimes and I can't." And she's on the sales side of things. Um, the problem with complexity is that it can make that worse, right? It can put another layer on top and make things even more difficult. Is that what you're seeing too with this attempt to put AI in healthcare?
It definitely can happen. And I think that the issue you're describing is a common issue where it's basically choosing the wrong problem to solve. And I mean, what I mean by that
Mm.
is, maybe you're saying, I really want to use AI to solve this problem, but there's a lot of reasons that might not be a good decision. First of all, maybe it's not a real problem. Maybe it's actually just a minor annoyance and there's no reason to put a huge amount of money into trying to get AI to do it. Or, maybe it is a real problem, but AI is not the right solution. Maybe what you actually need is a policy change, or maybe what you need is some change in your interface or something else. Like maybe there's some other way to solve it that's not AI. And then, I could go on, but like basically, if you pick the wrong problem to solve and you're just trying to force AI onto it, that can definitely end poorly.
Yes.
Because you need to understand like who's going to benefit from this and why are they going to benefit, and also why specifically is AI the right tool to solve this particular problem.
That's right, because at the end of the day, I see AI as fundamentally a pattern recognition tool at the moment. Um, LLMs are big and they have other sort of ways of making that work better than just basic pattern recognition. But if you can't sort of stabilize the data in and what you're asking it to do, uh, you're not going to get good data out, right? Um, it's kind of this black box, the way I see it in simple terms. You've got to get a clean data in. So to me, there's always a good analysis section that has to happen, or discovery element to what's really going on. And the danger is saying, "Oh, we've got to get AI into the business. The competition's coming. I got to do it, and let's just ram AI in here and see where it goes," without doing this analysis piece at the start. As somebody else said to me the other day, everybody's an AI expert, but almost everybody's getting it wrong, or something like that.
And I mean, there is a lot of material about what AI can do that may not be entirely accurate. I mean, something I've come across lately is, it does change over time, depending, there's like a kind of flavor of the month for what new thing people think AI can magically do for them. And I think something I've come across a lot recently is a lot of the way that AI agents have been framed is that they're basically people. And, you just have this AI agent, you just tell it what you want it to do, and it just goes and does it. And they're very much not like people.
Oh yeah.
Process of setting up an agent to do something for you automatically is very different than hiring a human being and training them to do that task. And I feel like I end up having all these conversations where I have to disappoint people because they're like, oh, I want to have an AI agent who's going to completely replace every single thing that my front desk receptionist does. I'm like, well, that's going to be really tough because I'm
Yeah.
sure that person is actually doing hundreds of different things. And if you wanted to have those automated, you're going to have to look at every single one of them separately. And you're going to have this deep integration with whatever software they're using. And maybe they're actually using 4 or 5 different pieces of software. And then you need integrations with all of those. Da, 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 da. Like the agent can't just automatically integrate itself. So yeah, it's an interesting time. And, I'm sure 6 months from now, it'll be something else.
Yeah, yeah. Look, Rachel, I've had a lot of fun here, and I really want you to come back, but we're running out of time. Is there anything you'd like to say, or you got any questions for me?
What are you most excited about in the AI space these days?
Oh, what am I most excited about? Gosh, you've really put me on the spot here because there's lots of things that I'm really excited about. I'm not going to say data centers in space. I don't think that really excites me. Um,
It
I
does
think,
sound like science fiction, though.
yeah, yes, it does, and I guess that's a part of the luster, but doesn't really excite me. You know what excites me, and it always has been the case with technology. I find out something that I can do so much better with a piece of technology, and I get this oh wow moment. And AI has been doing that for me a lot lately. I'm going to use a non-AI example. When I first had my first computer, can you believe it was a time before computers? I was a terrible writer, still am. I could use a word processor and then I could fix up all my mess, and that was a wow moment. And then I had Lotus 123, which was an Excel spreadsheet. That was a wow moment. And then with the web coming on where I could get access to company websites, that was a wow moment. And I'm getting a lot more of those. They're coming faster and faster. And so my day gets better. I used to have to spend a lot of time with people trying to get reports done or presentations or understanding my research. I can do it so much quickly. It's cut my time down, and that makes it more fun because I can make progress really quickly on my own. So that's what excites me. Thanks for asking.
Yeah, it is definitely I've also had a lot of wow moments recently with
Yeah.
what AI can do.
Yeah. Do you want to name one?
I think the first time I chatted with a large language model that was actually fluent, that was a wow moment because in
Hmm.
graduate school, when I was diving into language models, they were still pretty bad. So they would do sentences like, the cat walks, 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 walks. They were just stuck in these loops, or they would have gibberish or things like that. And so I think the first time I had a chat with a language model where it actually, it was a fluent conversation, it all made sense. There weren't any repeated words, or
Hmm.
it didn't start going off the rails about something. I think that was definitely a wow moment for me.
Yeah, and I can understand that. So I have one more question for you, Rachel, before we wrap up. Uh, AI, is it hype or help?
I'm going to give a difficult answer to this, which is that it depends.
Hmm.
So,
Hmm.
I mean, some AI is hype. So, I mean, anything that's claiming to solve all your life problems with AI, that's that's definitely hype. In the more specific example in the healthcare setting, anything that's saying AI is going to completely replace your doctor or completely replace your nurse or something, that's also in the hype bucket. But also, there's a lot of AI that is truly helpful and it's having a really positive impact now. And there's also new forms of AI that are being developed that are going to become helpful soon. So it's both.
Yeah. Well, fantastic. That's a great answer. I really enjoyed having you on. There's so much more I want to talk with you, Rachel, about. Maybe we can set up another time for you to come back. Also, stick around when we finish up here because I want to have a quick chat to you. All right. Well, bye
Sure,
for now.
sounds great. Thank you.
Well, I hope you enjoyed that as much as I did. Rachel was fascinating to listen to. We did a deep dive into medical imaging, what's happening behind the scenes in the medical industry and how it's being revolutionized with AI. So, when you go to the doctors and you get an x ray, you might not know what happens behind the scenes. Well, traditionally, that has been a radiologist who has manually looked over and made their recommendations and reports back to the physician. Well, now AI is in the picture and it's doing a really good job of supporting, not replacing, but supporting radiologists. There's also lots of startups out there who are creating unique models solving particular problems around the healthcare. For example, is it detecting clotted arteries in the heart, or is it looking at some liver deformality? So there's many startups in this whole ecosystem with specialist models that they're creating. So how it works is the hospital system connects through often an aggregator, and that through an API, that information comes back, the image goes out, the information comes back with a diagnosis or with a report associated with that image. So that then comes back to the radiologist and it supports and helps them. But we also found its limitations not very good. And she talked about an example of it was biasing the results because there was a different machine being used in one hospital than another, and that was swaying and skewing the results. So look, there's plenty of ways this can go wrong, and we talked about a few of those. But overall, the trajectory is very positive. It's making patient care better, and one fundamental way it's doing that is making that diagnosis quicker. And we talked about an example of somebody coming in to the emergency after an accident, a car accident, maybe they're unconscious, they go get some scans, they can very quickly get the information back and often see things that they might not have been looking for, so they can get the treatment going very, very quickly. Well, I hope you liked that show. If you know more about Rachel, follow the links in the description. If you want to know more about Skillion, then please do the same. I hope that helps, and thanks for watching.